Ensure that the ET tube is connected to the ventilator using a swivel adapter. Support the ET tube and tubing as needed. If ET suctioning is indicated, hyperoxygenate the patient before suctioning and between attempts. If the patient is intubated nasally, clean around the ET tube using saline-soaked gauze or cotton swabs and blot dry. If the patient is intubated orally, remove the bite block or oropharyngeal airway. Initiate oral hygiene with a pediatric or adult soft toothbrush at least twice a day, using a toothpaste or oral cleansing solution that assists in the breakdown of mucus and debris on oral tissue and teeth. Gently brush the patient's teeth, including the molars and premolars, which contain the greatest amount of plaque, for 2 minutes. Include the tongue and surface of the ET tube in the cleaning regimen. Suction oropharyngeal secretions after brushing. Use oral swabs with an oral cleansing solution to clean the mouth between brushings. Suction oropharyngeal secretions after cleaning. Apply a mouth moisturizer to the oral mucosa and lips every 2 to 4 hours to keep the tissue moist. Suction the oral cavity and pharynx frequently. Maintain continuous subglottic suctioning, using a specially designed ET tube for a patient with a high risk of VAP. Use intermittent oropharyngeal suctioning. Provide daily care with an antiseptic oral rinse, for example, 0.12% chlorhexidine gluconate. Move the oral tube to the other side of the mouth daily to prevent pressure ulcer formation. Replace the bite block or oropharyngeal airway if necessary to prevent biting. If deflation of the cuff is necessary to move the tube from one side of the mouth to the other, perform deep oral suctioning before deflation. Change the tape, ties, or commercial device after completing oral hygiene. If the securing mechanism becomes soiled or loosens, more frequent changes may be necessary. Ensure proper ET cuff inflation. Maintain cuff pressure at 20 to 30 centimeters of water and check the pressure every 4 hours. Reconfirm tube placement and document the position of the tube at the teeth or nares. Common tube placement at the teeth is 21 centimeters for female patients and 23 centimeters for male patients. Rinse debris from the oral suction apparatus and dry after each use. Replace the cover if present. Change oral suction equipment and suction tubing daily or per the manufacturer's instructions.